My name is Jonathan Scott Hall. I'm a physician working for the Florida Surgery Consultants Group. I practice in the field of neurosurgery where I'm board certified, and I've been in practice in the state of Florida for about 20 years. My interest in neurosurgery began in medical school as I was going through different rotations and learning about different aspects of medicine. I found myself most fascinated with issues affecting the brain and the spinal cord and the nerves in the body. I was fortunate enough to attend Columbia University's medical school in New York City, where they had a fantastic department that was very encouraging of students to participate and learn about the specialty. That passion that I developed for the neurosciences, combined with my enjoyment of the surgical aspect of things, culminated in my deciding to pursue a career in neurosurgery. I'm not someone who has some childhood dream of pursuing a career in medicine. No one in my family has made that decision, but in undergraduate I wound up obtaining a chemistry degree, and I realized at some point that I was taking all the same classes that all the pre-med students were taking, and this was a very competitive environment, and I really took the MCAT test to get into medical school to see how I would do, and I did well on it. And I only applied to a couple medical schools, including Columbia in my hometown of New York City. And when I got early admission to Columbia, I decided I couldn't turn that down, and that's how it started. There's an emphasis on minimizing the invasiveness of whatever kinds of treatments or procedures that we offer patients. But if surgery seems inescapable, we explain the reasoning behind that to the patients, walk them through the advantages and disadvantages of different treatment options, so that the patient can make an informed decision about what they want to do. I find it particularly helpful to share with patients personal experiences with other patients that I've had. It was a fairly recent, somewhat entertaining story where my next door neighbor came to visit me, and you could tell that she was having a lot of distress getting into the office. She was in a lot of pain. She could barely walk, and I walked her through all the details of the surgery. And when I was done with my presentation, she asked me how the recovery was, and I said, well, the recovery should be really a piece of cake. You should be walking around your neighborhood the next day. And she said, you mean your neighborhood? And I said, no, your neighborhood. And she said, you mean your neighborhood? And then it clicked, and then I realized this was my new next door neighbor. And the next day she was walking around our neighborhood without any troubles, and there was a nice gift on my doorstep because she's my next door neighbor. My favorite part about being a neurosurgeon is to have the opportunity to interface with other people that are really suffering and try to eliminate that suffering. That's a very rewarding and gratifying experience, and makes all the years of hard work in school and training worth it.